Did you know that the liver is the only organ in the human body with the ability to regenerate? Fascinating, isn't it? Hello everyone, I am Dr. Siddhant Bhargav and I am on The Liver Show, a one-of-its-kind health-focused show from Medanta that is going to cover, or should I say uncover, important information about the liver to help you become more aware and be in a good space to take care of it. And for this, I have none other than one of the most respected liver surgeons, specialists and expert in the field of hepatology. We welcome Dr. Arvinder Soin, Chairman at the Medanta Institute of Liver Transplantation and Regenerative Medicine. He's a Padma Shri awardee and a recognized voice for his contribution to the field. Sir, we welcome you to the Liver Show. So many accolades. It's been an eventful career. How did you actually get into the field of hepatology?
Thank you very much, Siddhant. It's good to be on the Liver Show. I used to come across cases where patients had liver failure or liver cancer or even large liver tumors which needed liver surgery. And of course, liver failure and liver cancer often needed a liver transplant, a service that was not available in India at the time, and I saw many patients dying from it. That's the time that I decided that I have to specialize in this field, which is kind of underdeveloped, and it was an unmet need at the time.
So you've been doing liver surgery for about 30 years now.
That is right. Yeah.
So sir, if you could tell me, does every bad liver have to be transplanted, or do you save a lot of livers too?
You know, to answer that question, Siddhant, you have to understand why a liver goes bad. And liver can go bad because of basically 4 diseases in adults. All these diseases are actually easy to control and, in fact, prevent.
Okay.
But once they become advanced, it's then that you have to start thinking of a liver transplant. So the answer to your original question, does everyone with liver disease need a liver transplant? The answer is no. Only about 10 to 20% of the patients will eventually go into liver failure and need a liver transplant.
A lot of people ignore liver health. Maybe it's not as spoken. That's why we got the Liver Show. But this is something people need to understand, that the liver is as important as the heart.
Absolutely.
Now,
Absolutely.
moving on to a meteor question. Liver transplants, you do this day in and day out. Medanta does this day in and day out. But a liver transplant sounds scary. What is that breaking point? How do you decide that, yes, this person needs a liver transplant?
So the liver, apart from its quality of regeneration, which you talked about in the beginning, also has another quality, and that is reserve.
Okay.
So liver has a lot of reserve. Not until about 60 to 70% of the liver is damaged do people start manifesting signs and symptoms of liver disease. So what you're asking is, what is that point?
What's that tipping
at
point?
which the signs, symptoms, lab tests become so bad that you think of a transplant. So that point is usually reached when a person with liver disease, specifically cirrhosis or chronic liver disease, goes into a phase of decompensation.
Okay.
So there are 2 phases. Compensated phase, which means, okay, the liver is bad, 40-50% damaged, but the person is managing to live a normal life. There are no serious complications. But when serious complications happen, for example, collection of water in the tummy, which may get infected, bleeding in the vomit or in the stool, or a pre-coma or a coma-like state where the liver failure affects the brain, or the kidney and the other organs getting affected because of liver failure. These are very serious complications.
Yeah.
At one of these or more than one of these complications is the point where you think of a transplant.
So Dr. Soin, I think everyone wants to know, and this is the most common question you probably get, how successful is a liver transplant?
Liver transplant is very successful. People are scared of having liver transplantation, and I often tell them, look, please do not be scared of the treatment of your terminal disease. It's the disease that you have to worry about.
Yeah.
So among children, the success rates of liver transplantation are as high as 98%. And among adults, it's about 95 to 96%.
Are there any restrictions with respect to who's eligible for a transplant or not? Is there an age limit? Is there a healthy component or a health score that a person needs to tick off before he can actually get a transplant done?
So that's a two-pronged question.
Two-pronged question.
Let's look at the age first. We've transplanted babies who are as small as 2 months, 2 kilos,
Wow.
to people who are 80 years old. Among these 4,000 cases, we've done more than 300 small babies less than 8 kilos. They're like this big. And we've done over 250 patients who are over 70 years of age.
So I had asked you this on the previous question as well, that we mentioned people who are eligible. You spoke about the age factor. Is there a health score that makes someone non-eligible for a liver transplant?
So in this case, we have two important clinical scores. One is CTP score,
Okay.
and the other is a MELD score. And when the CTP score gets to 8 and the MELD score gets to 14, that's the point we start thinking of a transplant. There are no upper limits on the scores which restrict a transplant. But what restricts a transplant is if the person is not expected to have a healthy, normal life despite a transplant.
I think that answers my question. We spoke about how some people wouldn't be able to take the recovery post-transplant. So what actually happens in the recovery post-transplant? Are there too many restrictions on an individual? Because you spoke about they have to be on 1 or 2 immunosuppressive drugs for, say, a couple of months, and then I'm sure the doses keep reducing as time keeps passing.
Absolutely.
But are there any other restrictions that a person has to keep in mind?
Well, no, absolutely not. So let's talk about living donor liver transplantation, in which a healthy family member donates half their liver for someone suffering from liver failure in the family. So the donor is back to normal life in 1 month, and the patient is back to normal life in 2 months after discharge. And honestly, after 2 to 3 months, there is no restriction on what a recipient can do or cannot do. Everybody after a liver transplantation will live their age-appropriate life normally.
Yeah, I think that instills a lot of confidence. It's got a super high success rate. Everybody could be eligible for it. Not too many restrictions. You live a normal life. I think this was needed, I had no idea about all of these things that you told me, and I'm supposed to be a doctor. So Dr. Soin, what is the life expectancy of a person who's undergone a liver transplant?
That's again a very relevant question. And I'm asked this literally by every patient that is consulting us for a liver transplant. The answer is liver has unlimited shelf life. It's a robust organ. Once transplanted successfully, it's going to last for the patient's entire lifetime. So the longevity of the liver is basically the entire lifetime of the recipient, provided they have had a successful transplant. And of course, 95 to 98% of them, depending on age and other premorbid factors, will have a successful liver transplant.
Superb. I think that covers all of my questions. I do have another theoretical question. If there was a patient who received a liver when they were young, they grew up, they had children who also needed a liver transplant, could an ex-recipient be a future donor? Is that a possibility, or that'll be completely contraindicated?
So the simple answer to that question is no. A previous liver recipient will not be able to donate a part of their liver for a transplant.
Okay, got it. Thank you so much, Dr. Soin, for being here on The Liver Show. I've learned so much. I'm sure the audience has learned so much. Thanks for taking out time from your busy schedule to educate people.
Thank you, Siddhant. It was great to be on The Liver Show with you.
So, this was Dr. Soin. He spoke to us about the importance of a healthy liver and transplants. See you in the next episode of The Liver Show. Till then, please take good care of yourself and your loved ones.